name is Maya, and I'm going to be your nurse today. How are you doing today?
Good.
Good. Are you having any pain today? No? Okay. And I'm going to kind of spark up conversation with the patient before I go and touch the patient. And I'm going to ask her name and date of birth. Can you tell me your name, please? Brinley. And I'm going to look at her armband as well for 2 identifiers. And I am going to listen to your heart and lungs and check you over and make sure everything's okay. Is that all right with you?
Yeah.
Okay, and when I get their permission, then I will proceed with the head-to-toe assessment. Can you tell me what today is? Do you know what today is? Saturday. And do you know what tomorrow is? What's tomorrow? Easter. And then I will ask them a couple questions pertaining to place, time, their situation while they're in the hospital, and see if they are alert and oriented, and see if they know if they're alert of what is going on. And then, can you smile for me? Okay, and I'm going to have the patient smile, looking for symmetry, for neurological. If they were laying on the pillow for a while, I would check the back of the head, look for any sores, and if they were here for something that pertained to the upper of their head, then I would look further into their head as well. I'm going to shine this light, and if you look straight ahead, okay, good, and I'm going to use my pen light and check for the reaction of the eyes. And then when I have my pen light, I could check into the ears just to see if there's not any drainage or any heavy earwax that's coming out. And then I'm going to check your lymph nodes. Okay, and can you shrug your shoulders for me? Good. And then, can you feel me touching? Okay, any pain there? Okay. No. And then I will have check the radial pulse on both arms and kind of compare the pulses. Okay. And then, can you squeeze my fingers as hard as you can? Good job. Okay. Can you pull my fingers to you? Nope, pull them to you. Okay? And then can you push my hands away? Push my hands away. Okay. And then check their musculatory system, and then I will go to the listen to the heart and lungs, and then while I'm have my stethoscope on, I will listen to the bowel sounds, and before I palpate, I will listen, and I will listen to the bowel sounds and then palpate. So I am going to listen to your heart. Okay. And when I'm listening to her heart, I'll listen for 30 seconds. And then when I'm listening to the apical pulse, then I'll listen for 1 minute. Unless I hear something abnormal, then I'll listen longer. Okay, can you sit up for me? And I'm gonna listen on the back. Can you take a deep breath? Good job. Another one. Okay, another. Deep breath. And one more. Good job. Now I'm gonna look at the abdomen, see if there's any lesions, rashes, anything abnormal. And on the bowel sounds, I'm going to start in the lower right quadrant and listen. And then I'm going to go to the upper right upper right quadrant. Then I'm going to go to the upper left quadrant. And then I'll go to the lower left quadrant. Okay. And then when I push on your tummy, is there any pain? Anything? Nope. Okay. And then if they were here for something in their genitalia area, then I would inspect that area. Otherwise, I can ask them, when was their last bowel movement? And if they don't understand, then I'll say, when did you go poop last? When's the last time they urinated? Kind of questions that pertain to that area. And then I will move on down to the legs. And I'm going to check the legs for any rashes, any edema. And if I do spot edema, then I'll press to see how bad the edema is. And then I'll inspect the legs and then feel for the pedal pulse. And if I don't feel the pedal pulse, then I'll go get the Doppler and do it that way. Okay? Can you push against my hands like a gas pedal? Push. Okay? And then can you pull your toes towards your face? Alright, there we go. And I got the pulse, check their strength. Do you have any pain in your legs?
No.
No pain? No pain when you get up to walk?
No.
No? Okay. And then I think that is it for my health assessment. And thank you.